And welcome back to HealthView. This is Dr. Angela Ruff, and again, our guest today is Dr. Felicia Baxter, who's a pediatric specialist, and she's given us really fantastic information about how to keep your kids healthy and out of the ER. And during the break, we're talking a little bit about something that's near and dear to your heart, vaccinations.
Yes.
So maybe you can talk a little bit about that.
Mostly what I do in peds is I try to keep your children healthy. Sure. I was actually general pediatrician when I first started out my career right at Pope Air Force Base. And like put a plug in there for the A. No, it's not us.
Is that not y'all?
No,
well, do y'all have a fun, what do you say?
I have no idea. I can't remember.
Do you make an
I don't
airplane
think we
noise?
make a noise or anything. I just don't remember. I just remember the blue uniform. But general peds, it encompasses a lot of things. We stay with the children from the time they're born, basically until they're 18, and then they still try to sneak in there. But we try, one of the main things we do as a general pediatrician is immunizations. Most children receive their most comprehensive amount of immunizations within the first year of life. It starts most of the time it starts right after they're born, and then at 2-month intervals after that, up until they're about 18. Now it's actually 2 years old. And there are minimum of about maybe 11 or 12 different diseases that are vaccine preventable that we protect kids against. And fortunately, I think we're adding to that every single year. Now, I'm a big wimp. I hate needles, but I will get my shots, period.
Yeah.
So,
well, we're discussing how you actually got to enjoy the flu, and that's a real motivator for you to never miss a shot again.
My third year of medical school, oh man, I'm so old. 1996. Remember it like it was yesterday. I got laid up, or I was out for a week. 103, 104 temperatures. I was just shots of NyQuil and Motrin and trying to keep water down.
Right.
High fevers. Actually, I told someone this recently. I said, if I came in the condition that I was into the ER, I probably would have gotten a spinal tap, because I swear I had viral meningitis.
Seriously.
I was very, very ill.
Yeah.
And most people, adults, can't miss that much work because you're sick, you can't go in, and that's income. And then the same thing, miss days of work, not only when you're sick, but also when your child
kids.
is sick.
Right.
And the people that get the sickest are children under the age of 3, and then of course older people like 65 and older. So the recommendations have changed, where now we have flu vaccines. Comes in 2 forms, either flu mist or the shot, where it is approved down to 6 months. From 6 months to 6 years, unfortunately, it's a 2-shot series. You come in, get the half dose, and then you wait another month and you get the other dose. But again, that's a particular disease. If you can prevent it, get the shot. It's so much easier.
Now, tell me a little bit about the Tamiflu. That medicine. That's just to help the whole family not get wiped out with it. Is that right?
Yes. Now that's actually a recent phenomenon, a prophylactic or preventative if you've come into contact with someone. But Tamiflu, ribavirin, there's a couple of other medicines that are out there that, in particular, Tamiflu, if you have gotten started your symptoms within 2 days, and you have proven influenza A positive, if you start taking this medicine, it can shorten the course of the disease. Not only a preventative, but it shortens the course of the disease. Instead of you being laid up for a week and a half like I was, you can it'll shorten it down to about 4 or 5 days.
Yeah.
On this medication, the temperatures go down faster, the achiness, a lot of the other symptoms of flu. In addition to, if you have the flu, you give it to family members. It has been associated with them keeping them from getting it.
That's great. But obviously the better choice would be to get your whole family vaccinated.
Just to get your whole family vaccinated, exactly. This year, I think they were expecting a huge shift based on some of the monitoring systems around the world. So they changed the combination of what virus components that they actually put in the flu vaccine drastically changed this year.
Wow.
And so we're going to wait and see how much protection that it affords.
Right.
But I really would like to reemphasize, or just try to put out there, that if you get the flu shot, it doesn't cause the flu.
Right.
Period.
Right.
Just put it out your mind.
Right.
I'm so sorry if you, while you were waiting in the waiting room and you got your flu shot, you picked up some other virus while you were in there, but it was not the flu.
Right.
There's the components of the flu that gives you the immunity or have no live components in it.
Right.
It does boost your immune system, may give you irritation at the site, but fever, achiness, there are other viruses that can cause you to have a flu-like syndrome. The likelihood if you're getting the flu from the flu shot is about zip.
Yeah. We were talking earlier. I mean, we give the flu serum to our staff, and it seems like every year I have at least one person who's like, "No, I'm not going to get it." I'm like,
you'd be surprised how many, like in the hospital in Colleton in South Carolina, they give the nursery nurses an option not to get the flu shot. And I'm thinking, number one, most of us can't afford to miss work because if you don't work, you don't get paid. But at the same time, because you could have this particular virus because it hides in your nose and give it to one of the infants,
be a carrier.
That's not acceptable, I think. But you're right. Some people still have that myth that they swear out that they got sick from the shot, and that's not even true.
Is it still, if you're allergic to eggs, then you
can't get the flu shot.
Can't get it. So
that's the only indication where you should not get
so
that
you're all
shot.
the only ones who get a free pass then.
That's the only one that's true allergy to some component in the immunizations, or if you have like some type of seizure disorder, some of the vaccines you should not get.
Can't get. Okay. Well, I know it was in the news recently about there's a judge in, was it here in North Carolina?
I can't remember, but I think that's somewhere in the southeast. Someone was going to jail because they didn't vaccinate their children.
They did, yeah. They're going to round them up, and I think they had the vaccines at the
trial.
They did. So either bring your kid, get him vaccinated, or you go to the pokey.
And sometimes, like seems like on the internet, with the advent of the internet, there's like a terror campaign why you should not get your child vaccinated. There are several unsubstantiated reports about the increased incidence of autism. There's no correlation between MMR or mumps, measles, rubella vaccine and autism. I just think we're better at recognizing. I think it was always there, but we just didn't know what it was. But I don't think it's associated with MMR. Also, there was a big thing about the removal of one of the preservatives in vaccines. Thimerosal is a mercury-containing vaccine, and it's a heavy metal. Mercury causes several side effects: issues with your hair, your immune system. It can wreak havoc. As far as heavy metal poisoning. So they're saying, why are you putting this known poison in vaccine that's we're supposed to protect our children? So it started with hepatitis B, but we found out that they actually that particular preservative is ubiquitous in a lot of the vaccines, including some of the flu vaccines have that that component in it. My thing is, it has been removed from most of the vaccines. And the exposure is so minuscule, you're likely to die and get really ill from probably the vaccine, the infection we're trying to prevent versus having true side effects from that particular preservative.
It seems like there's always some group out there that's trying to go against this. I mean, we have them out there saying, "Oh, no to fluoride," and
to fluoride. They don't want the children to get even vitamin K, which prevents bleeding, your child from bleeding to death within the first several hours of life. We get it all. We get it all. Yeah.
So, but so the deal is give your kid every advantage you can to help them be healthy.
Correct.
And grow up as healthy adults.
And so you don't have to worry about them getting the chicken pox. When I got the chicken pox when I was 16.
Oh, I did too, yeah.
And it was horrible. Again, I was laid up again for another week with the high fever. But and there is a vaccine against that.
They used to, what they used to do when my sister and I were young.
They would expose you to probably the natural. Somebody
in the neighborhood had chicken pox.
The problem
Bring
with
the kids over. We all got the chicken pox.
That freaks me out because not only did you get the chicken pox, but we know it's that virus also sets you up for a super infection with staph and with strep.
Yeah.
And after you've seen a child's entire leg filleted open because they've gotten a flesh-eating type of bacteria secondary to chicken pox, or a child having to get open heart surgery because he had the chicken pox and one of these bacteria just infected the lining of his heart. You don't really tell people to do that anymore. Just give them the shot.
It does.
Just give them the shot.
Yeah, and because it sets you up later for shingles, And
you still get shingles. And we don't think that doing the vaccine you still have an incidence for that. That I don't think that's true.
Yeah.
So,
well, a lot of good things that are available now for kids today that I didn't get the advantage of.
Right. Exactly.
But now, Dr. Baxter, you mentioned that there are a lot of there's some websites you wanted to share with our listening audience that you offered us great information, but parents may have some other questions. Do you mind sharing those websites for our listeners?
Yes, I just want to put out there that there's a lot of information floating around different things. Some websites are more reliable than others, and there's actually three, but there's two websites if you have any questions that you really want good information on, parenting tips, some of the latest advances in medicine, unadulterated, evidence-based. Go to WebMD. I love that website. Even as a practicing physician, plain speak, they put it in the things that they report it's very easy to read, but it's still evidence-based. I really like that website.
So that's webmd.com.
Yes, webmd.com. And then there's parents.com. That's another website that you can actually go to. And for physicians, I use not Ovid. A lot of the other Medline searches are actually kind of difficult for me to use, but I use MD Consult.
MD Consult.
.com. Type in whatever search parameters and or keywords, and they can give you that information. Also, the American Academy of Pediatrics website, aap.org, fantastic site. Not only do they have information for providers, they also have just list of information and just a wealth of information for parents.
Okay. And you were... If you don't mind sharing your email, so you may get some more specific questions that parents may have. If y'all listening would like that, her email address is Felicia.Baxter, FELICIA.BAXTER at DalesAngelsInc.com, and that is spelled DalesAngelsinc.com. So, okay, only one email per family.
But just so you know, I answer all emails.
That's great. Well, we're going to give you lots of homework then. So, Dr. Baxter, it's really been a pleasure having you with us this morning.
Thank you so much.
You've given us fantastic information, and we hope to have you back again as...
oh, no, there's no problem. I have so much I could talk about.
Fantastic. Well, you certainly do have the gift to gab, but just not just gab, but gab with really great information. So thank you again. You've been listening to Health View at News Talk 640 WFNC. This is Dr. Angela Ruff.